Hi, I'm Christine Brookins, and this is Connecting Our Community. Today, I have the honor of being hosted in the headquarters of Keystone Global Media with the owner, Matt Leeper. Matt, thanks for having me.
Well, to be honest, thank you for having me. I've been looking forward to the opportunity to do this for a while, because usually I'm on that side of the cameras and I get to smile and laugh and point. So I get to actually do the interview with you today. So, but for everybody that doesn't know, I'm sure a lot of you guys already do. Christine is the founder of Outspoken, which is an organization dedicated to amplifying the voices of individuals with disabilities. It was launched in 2022. And Outspoken offers disability training, educational workshops, and individual consulting, striving to enhance the lives of those with special needs. I've had the pleasure of facilitating a lot of the recordings and stuff that you've done over the last year-ish, year and a half now. And I've had the pleasure of being able to edit and do a lot of the work with this series, the Connecting Our Community series. It's been kind of fun for me because to be honest, if you would have told me 2 years ago that I would be dealing with anything in this world, I wouldn't have known what to tell you. You know, coming from my background in that, I didn't really have a lot of touch points with the disability community, especially the areas that that you deal with and that you've got a real passion and heart for. It's fun. It's very humbling for me personally to be able to be associated with a lot of this. And actually, I'm kind of excited to see where this goes. You and I have had a lot of in-depth conversations. And it's actually, I think it'll be a good thing for a lot of other people to see your passion, your heart, and your why behind a lot of the reasoning why you do what you do. So I guess if it's all right with you, we'll just jump into it and kind of see where we go. So I guess what a lot of people don't understand is the why behind it. So your personal journey for this took place more out of for advocacy, took place because you're the mother of an individual that has and needs the services that you talk about all the time. So how did dealing with that kind of influence you to get to the part where we're at now with Outspoken?
Well, thanks for the question, because you are opening it up that I can share more about, you know, who I am and why I do what I do. So my husband and I are parents to 4 adult children, and our oldest son is 38 and has multiple disabilities. And to give you the shortest version I can of the story, when he was 18 months old, he received a medical diagnosis that put him on the track to receive some supports that he otherwise would not have received. And as a result of that, by the time he was 4 years old, he was already in a therapeutic preschool where they did evaluations, and he received several more diagnoses. And some of the things we'll talk about, having the diagnosis is the first step to accessing resources, because obviously you don't know what you don't know. And with my son, at 4 years old, he was in that therapeutic preschool because he could not function in a typical childcare or school setting. And my husband and I both needed to work. We needed both incomes to support the household. So him not being able to function in a childcare setting was problematic. Obviously, the best thing for him was to find the right supports. And when I did that, it provided a whole different avenue for all of us. So what I will let people know is that I am old enough and my son is old enough. Back when this all started, there was no internet. There was no opening a browser and asking Google what the question was. That didn't exist. You had to go to the library and read books to find any information. And then when I was looking for some level of support, I thought there's got to be somebody out there that can help me. I didn't know what it was. I just knew there had to be something. So this is, again, dating myself, but I went through the blue pages of the phone book. And for the millennials out there who don't know what a telephone book is or don't know what the blue pages are, that was a listing of government entities. So I just kept calling until I found someone that could provide some level of help that my son needed. And that was the beginning of this journey, because it wasn't easy to find, and I didn't want anybody else to have to go through that. So it was out of the personal need to find the resources for our own family that I accessed these things and thought, other people need to know about this.
Yeah, and I mean, to expound on that a little bit more, with Outspoken, you offer a range of different services, from disability training, individual consultation. You really have a passion in helping people fill in the gaps to get the support that they need, but they don't really know is out there. Could you elaborate a little bit more on some of the services that you provide, or in the manner in which you help people that come to you to get the services that they need?
Sure. So, I mean, one of the things that I will say that there may be a misunderstanding. You may think that if something is not fitting the norm and you're going to a doctor's office and you get a diagnosis, that, aha, now I have an answer. All you have is the diagnosis. You're not walking away with all the answers. You're walking away with a lot of questions. And when you have all those questions, and you may not even know the right questions to ask or the right people of whom to ask them. So that's the first thing, that there's that kind of a gap from, okay, now I have a diagnosis, to what's next. And then I would also say, to connect with the appropriate resources, you have to be able to find and leverage of whom to ask questions, what questions to ask, what resources exist, how do I get to them. And I look at, if I can connect someone who needs a resource with that resource, I've helped to bridge that gap. And that's what I want to do. No one should have to reinvent the wheel. If it's out there, I want other people to know about it.
And it is amazing sometimes because of the Rolodex that you have. I know I've come to you personally and asked you for some friends of mine that might be having some issues. And it never ceases to amaze me that you're like, oh, so-and-so and so-and-so. And then I've got this person's card. And, and not just that. I mean, as we build back to it, the speaker series, Connecting Our Communities, you've been doing in some form or fashion for almost 4 years now.
Right.
I know that since I've come on board to help a little bit put some of this stuff together, there's so many episodes that you did at the beginning that just, great information, but how did you find these people? So, for me, it's always interesting to watch those, but as we look forward, as we're looking at this, there's a lot of hours that you've spent in researching this, putting this together, the conversations that you've had with people on the Connecting Our Community series. There's been a lot of diverse voices on here. I mean, just some of the different episodes. Like, what of those episodes, does any one of them stick out that profoundly impacted you or your audience? I mean, you know how many episodes you've done. Like, what are some of the highlights?
Yeah, we are almost at, I think we're at 46 episodes now. And every month it's a different resource. A lot of this started going back to what my son needed. And when I found that resource, I wanted it to be easier for someone else to find. Or, it's that one thing like, oh, if I only knew. Well, none of this should be secrets.
Right.
So as I do this, some of it came out of direct contacts that I had or that families around me would have. But then every time I meet a person, I'm meeting another person or finding out about another organization. And while I do my homework on the front end, I can tell you that every interview I've done, I've learned something new from each speaker. Even though I try to know who they are and what they do ahead of time, that doesn't necessarily mean that we've touched on everything. There's always that aha moment when I'm talking to somebody about, wait a minute, we didn't talk about this. So I would say that I'm still learning every day. But again, I learn it, I want everybody else to learn it too. And when I look at every speaker brings value, there's a resource, there's someone that would benefit from that. One of them that kind of stands out to me because it's that epitome of the connections and making one after another was end of 2022. I had the opportunity to speak with Dr. Lynn Takelet, and she is the director of the University of Pittsburgh School of Dental Medicine Center for Patients with Special Needs. And that's a
Okay.
mouthful.
For sure.
But what they do through the dental school, they have a clinic where they are able to provide dental care for individuals with disabilities. And my son happens to be a patient there, but it was in having this conversation that I learned more about who they serve, what they do, how they're able to do these things. Obviously, any medical or dental student needs practical experience, but one of the real benefits through this clinic is that it happens to be at the University of Pittsburgh. They also offer a program that is around dental anesthesia. So they are able to provide dental care for individuals under general anesthesia. And what that means for a lot of people, my son included, is that the exam and treatment that they might not otherwise be able to tolerate, they're now receiving, and that's better for them and their health. When we had this discussion and I learned more about their services and who they serve, we were wrapping things up. And Dr. Takelet happened to mention a situation in which the family helped to coordinate with other medical providers. And as she was speaking, my eyes were getting big and my jaw was dropping like, wow. In this situation, because they offered the general anesthesia and the patient could tolerate things, the family coordinated with 2 other doctors. One of them was a PCP for this patient. This was a female patient that now was getting her dental exam and treatment, but they coordinated with Dr. Reed Van Dusen, and he is part of the Progressive Evaluation and Referral Center, the PERC clinic. It is a clinic through UPMC that provides medical care for adults with disabilities and medical complexities. And this particular patient had been treated through that clinic and needed some kind of treatment that she could not tolerate at the clinic, but under general anesthesia she could. And then taking it a step further, when Dr. Takelet told me about Dr. John Harris, and Dr. Harris is with the Center for Women with Disabilities at McGee Women's Hospital. He was able to come and examine this patient that would not have been able to tolerate a gynecological exam in their clinic without being under general anesthesia. And the quality of life for this woman being able to receive examinations that other women her age should be receiving and she otherwise couldn't, that just blew my mind. So what I can say about that is when I was told about this, Dr. Van Dusen had already been a speaker. We had talked about the PERC clinic. But 8 months later, Dr. Harris then came and featured the Center for Women with Disabilities that I didn't even know existed. So I now learned more about it. I'm speaking to not just my audience, but every day I'm encountering families saying, did you know this existed? And finding a lot of people didn't know that it existed. So to me, that was one that I met someone and spoke about what she does with the dental clinic. But it just blossomed into so much more, learning about that collaboration with the other medical providers. And then from that same connection, I've now had the opportunity to speak to the students that are now in this practical experience. There is a student club that is part of the American Academy of Developmental Medicine and Dentistry. And Dr. Takelet asked me to come in to speak to those students. So now we're impacting more of the disability community, because before these students go into their own practices, I've been able to come in and talk to them about disabilities and what this may look like and how they might be able to consider things in their own practices to better serve the community. So that was one episode that just kind of blossomed into all these other things. And ultimately, I feel like that connection, building the other connections, and learning about all of these things, now the expanse and the reach to the disability community is so much greater, because I started having a conversation with one person.
Yeah, and I mean, that's an amazing thing that happens. I know whenever you and I have conversations, I think the term I use all the time is spider webs, how they're always interacting, but I mean, the partnerships that are created between, now that doctor and then the other clinic and, Dr. John that you mentioned earlier, you've been a big advocate and a lot of your things go towards community partnerships. So besides just that episode, like, are there other community partnerships that, that you think you've helped generate, positive outcomes for the disability community?
I would like to believe that each one of these is generating something positive. That's why I do it. I would like to believe that if I have found a resource and I can let even one person know about it, that I've somehow positively impacted the community.
And I know that for a fact. I watch you do it a lot. So.
Well, I appreciate that. But I have to say, and for anyone who knows me, if we've had a conversation for more than 10 minutes, you've learned one of my strongest partnerships is with Special Olympics.
Yep.
And that is in various areas. So I am mom to an athlete, and I've volunteered and I've coached and I've served on committees. So I'd like to believe that when I am out there helping at a practice or at a tournament, that I am supporting those athletes and therefore benefiting the disability community. But I can also say that as a result of that partnership, I've had the opportunity to present information at parent workshops. And a lot of the families are just lost. We talk about you don't know what you don't know what questions to ask, you don't know what resources are out there. So I firmly believe that just standing in front of a room full of parents and sharing some of the things that I have learned have helped those families. And I think it then becomes a ripple effect, that you learn one thing and you tell one person and you're now benefiting the greater community simply because I open my mouth and I tell people something that I've learned, and somewhere along the line it's helping somebody else.
Yeah. I mean, as we're looking at this, I mean, you've been a mother to an athlete for a long time, but you've also maintained, a 30-year career before, you officially founded Outspoken. Like, what have you learned? Has that experience actually helped you gain in your leadership of Outspoken as an organization?
Well, I would say in my professional career, I still had to exist as that mom first. And in doing so, along the way, I learned a lot of things about the impact to my family. And as I learned those things, some of these things are as simple as anywhere you work, there are decisions you make with human resources when you onboard, and there are different, whether it's your benefits or whatever it may be in any field, there are considerations. And those considerations are very different if you have someone in the family with a disability. So I had to learn early on what I needed to do and not do. And it was a while before it dawned on me, like, hey, I needed to tell other people about this. Other people, like coworkers, family members, whomever it was, and then get out to the greater community. I've learned these things and they're not necessarily intuitive. So I want to help other people do that. I'd also say that as far as founding Outspoken, that realization that not only did I need to learn, and I'm sharing with other colleagues and family members, but I need to do more. There are people out there that don't know these things. I didn't know any of this 38 years ago. I had to learn along the way. So really my experiences led me to no, there's more that needs to be done, and I'm in a position to do some of this. So founding Outspoken was just the natural next step.
Okay. And I mean, that's logical. You've lived the life. You've done a lot to help other people that are living a similar existence that you have. But one of the other things that I don't think gets brought up enough is Outspoken's, educational mission to not just, teach people about the services and things, but also to kind of, do workshops for people like myself, people that don't have touch points inside the community like you do. We had the event with the Pittsburgh State Police that I was allowed to go and kind of help do some of the back end facilitation with. Like, what are some of the common misconceptions about the disability community that those workshops address or try to address to give, for lack of a better term, lay people like myself or maybe somebody in the audience? Like, what are some of the misconceptions?
Well, I think you brought up the point. Like, if you don't have personal experience with any of this, how do you know? As I said, I didn't know any of this 38 years ago. So I always go to the you don't know what you don't know, and we all are built of our own experiences, and if it wasn't part of your lived experience, no one can expect you to have that knowledge. So part of what I do is I want to go in and just cover some of the disability basics. What is a disability? How is it defined? And oh, by the way, it's defined differently for different purposes. I also want people to know things like assumed competence. That is a huge one there. If you don't know, you may assume that the person who doesn't talk can't understand what you're saying, and that can be so far from the truth. So I want to go in and provide some of those basics. What is a disability? What does it look like? What does it not look like? Because many of them are hidden.
Yeah.
And I want to head off misperceptions. Also, if you're going to engage with anybody that has a disability, make the effort to use proper etiquette. And what I mean by that is person first. Remember that every person is just that. You are Matt before you are Matt who might have, a bad back or something like that. And similarly, every person comes first. Their disability happens to be a diagnosis that they have. So I will go over terminology, etiquette, how to engage someone, because often we're afraid of what we don't know, and so we avoid it. Along that line, don't avoid a conversation just because you're afraid you might say the wrong thing. Mm-hmm. It's obviously appreciated if you make the effort to do the right thing, but you have to start somewhere. And don't avoid interacting with someone that has a disability just because it's not familiar and might be uncomfortable. I didn't know any of this before I stepped into it and tried to learn about it. So I try to share what I've learned personally and professionally to help other people. And that could be in your business, in the community. Maybe there's a family member that you see once a year at Thanksgiving dinner and you never really understood why that person seems to behave differently. And then you mentioned the training with the police. With members of law enforcement, God bless them, they have to make split-second decisions.
Yes.
And they could be life and death decisions. Mm-hmm. So it's so much better if their training includes things that in that split second, they're actually considering. Maybe that person whose behavior seems out of place might not be under the influence of drugs or alcohol. It might be autism or Tourette's syndrome, or perhaps the person is having a seizure. And if you don't have that training to learn to consider those things, face value is going to be based on what your experience is. And if your experience never considered there could be an underlying disability, your perception, it could be way off. And let's be honest, we all see things all the time and make judgments, and those could be inaccurate. Mm-hmm. You have that false perception of what's happening, so you may judge that, and you could be way off. So I just want to share, consider what else could be going on in your family, in your community, at work, whatever it is. I just want everybody to have those basics, because it may not be your lived experience, and that's okay.
Yeah, and if you wouldn't mind, maybe elaborate a little bit more on that, because I thought, like I said, I got a chance to participate in that, and I thought that was a very interesting conversation the evening that we did. Dealing with the state police, dealing with the county police, like the conversation from the disability advocacy side and the conversation from the law enforcement side, there are some things that don't always cross over.
Right.
Like, for instance, you have the seatbelt information card for your son because he's nonverbal. Like there's not a situation where he would be able to interact, especially if, we've got a high stress situation. Just some of the things, if you wouldn't mind, because again, I thought that was very interesting. Could you just give a couple of the things that maybe you do personally that helps with those interactions?
Sure. Well, hopefully I never get pulled over. And if I do get pulled over, that my son's not in the vehicle with me. But God forbid that should happen. Or if we're in an accident and my son is mostly nonverbal, cannot communicate, cannot have a conversation. And if you need to know a medical condition or a behavioral thing and you don't have that. So personally, I do a number of things, and these are resources that I leverage.
Yeah.
So I have stickers on the back of my vehicle. One indicates that kind of draws the attention to any first responder that there may be somebody in the vehicle that is nonverbal and doesn't understand simple commands. Unfortunately, there was a time in his lifetime where my son was in a vehicle that an officer came up, and had that officer done the, nobody move, that is not something that, first of all, my son can understand, and secondly, would be able to comply with, and that could make a difference in the interaction. I have another sticker that indicates someone with autism on board. And part of the reason I have both of them, they were issued by different counties, and I travel between counties, so I want, wherever we are, I want it to be familiar to those responding officers. Mm-hmm. You mentioned the seatbelt thing. So on where my son typically sits in the vehicle, on the seatbelt is something that indicates that the person has a seizure disorder. And inside you place a card that has some information, because if we would be in an accident and I'm unable to speak for him and he can't speak for himself, it would be really handy for the responders to know of a medical condition. Another thing I leverage in Pennsylvania, we have the Yellow Dot program. It's actually supported by the Department of Transportation, and anyone in the state can make use of it. As it sounds, the Yellow Dot is a little yellow sticker that goes in your back window, and it is to indicate should there be any kind of accident and you need information. That yellow dot says go look in the glove compartment for a booklet that you complete with information about yourself as the driver and any family members that may be in the car. Because again, if I can't let you know I have such and such diagnosis, I'm on this medication, in an emergency situation, that could be very helpful information. So just personally, I leverage, and those are all different programs, again, by the state, the 2 different counties, and the seatbelt item was through the Epilepsy Association. But there are those things out there. They're all free resources. Should there be a situation, leveraging those resources can make a tremendous difference in how things proceed and can matter in a life or death situation. So just getting the word out to other people, hey, it's there, it's free, this is how I use it. I have a similar sticker on my house that indicates that there may be an occupant of the house that doesn't understand simple commands.
Right.
Because if ever first responders need to come to my home, for me or anyone else, it's good to know you're going to encounter someone like that. Another thing I leverage, I live in Allegheny County. Allegheny County has a special needs registry. So my address is registered with the county dispatch. Should 911 be called to dispatch to my address, it should flag in their CAD system that there is someone at this address that has a disability. And that could be something like you have a wheelchair user that can't exit on their own. You have someone with autism that may perseverate, may hide, because that's common in emergency situations, that maybe someone with autism may hide. Whatever it is can help those responders to better know what's going on and be better prepared. And honestly, can make the difference with somebody escaping a fire, somebody getting the proper treatment, or if you have to get past a person with a disability to get to the person that requires a response to understand what that might look like. So I leverage all of these resources personally, and I get the word out about any of it to encourage other people to do the same.
Yeah, and building on that a little bit, I was unaware that any of those things existed. You know, looking at the back of your car, now I've noticed some stickers, similar stickers elsewhere, something that never would have drawn my attention. And the yellow dot program, I've seen multiple times now. It would have just passed over, like it would have been there and gone. I never would have realized what it was. Now I'm driving and, you know, it's caught my attention a few times while I've been on the road, and now I understand what it is. Like having no experience with it, the yellow dot literally would not even register on my radar. But now that I have an understanding of what it is, like, you know, or in a situation now that if I would be there, you know, something happens, God forbid, but I would be the first person on a scene. Like it's beneficial to know how that stuff plays. But I guess, you know, let's switch gears a little bit here. Let's get back to a little bit more with what you guys are doing with like the community sharing. So I want to make sure that I pronounce the name of the organization right. But you have involvement with the Special Needs Consortium.
I do.
And their big push is to you know, resource sharing.
Yes.
So how has this network enhanced Outspoken's initiatives? Like, how has your work with them benefited Outspoken and helped push you forward?
So when I was introduced to the Special Needs Consortium, what I needed, the first thing I learned is the consortium was originally established so that providers would know about one another. The reality is, as a result of establishing this consortium, there's a website with listings that anyone, it's a public website you can go to look up and find a resource. So that's one of the first things. And then I would say my involvement there, I have found other resources that I didn't know about, whether I need them personally, a family I know might need a resource, or I've found other speakers that I want to highlight someone else that provides a service or support to the disability community. And then I can also tell you that in the interaction, we all spend our time in meetings learning about the other providers. One of the things that we found is there's a specific organization that's part of the consortium, and a big part of what they do, education and coaching of families and caregivers. They want to help you to be equipped with information so that when you are looking for something, speaking with someone in a meeting, you have the information you need. But they stop short of going to the meeting. And I don't want to mean that the organization falls short of anything, because they absolutely do not. But what they do is they will equip you with the information so that you can go in to that meeting and handle things. Well, often these types of things are very personal, very emotional, and maybe what somebody told me a month ago in a meeting isn't what's foremost in my mind. That is one of the things where I can go into the meetings. So I have spoken with this organization, and we have at least established that when they have a family that they've coached and they're launching, but maybe the caregivers don't feel that they can handle it all themselves. As an advocate through Outspoken, I can attend those meetings. So that could be an individualized education plan, an IEP meeting at a school, or an individual supports plan meeting for an adult that's in the community that gets supports. And quite honestly, I will go in and ask the questions that nobody else knows to ask. I will ask the questions that nobody else wants to ask. I will say the things that nobody else is saying. Honestly, when my son was in school, I didn't know. The school said, oh, so this is what we're going to do. And I just nodded my head and said, okay, I didn't know any better. Well, I know better now. And it's not that the schools aren't trying and don't do their best, but they have a whole school to worry about. When a family member is attending a meeting, they have one person that's their concern. And they don't always know what to ask or to request or what to suggest. And that's where I will go in and do those things. And one example of that is just simply the appropriate accommodation for the individual, because after all, the I in these is about the individual. And one thing that is of no cost to a school, an accommodation might be to provide a student with extra time. And for a student that requires extra time to complete the work or pass a test, that's great. But for the student that may have attention deficit hyperactivity disorder and can't sit still for the 30-minute class, suggesting that they sit still for 60 minutes is not going to cut it. And I'm generalizing there, but that is a free accommodation, so it's one of the first things that's offered, and it's appropriate for some, but not for all. So those are the types of things that I will go in and do that. And through the Special Needs Consortium, I've been able to make it known that if you are interacting with somebody that needs a one-on-one advocate, I can do that. And they too are able to feel that I know we need to support these people, but this is not something that our organization does, so maybe here's a way you can do that. So those have been some things that I think are mutually beneficial throughout the consortium, that everyone is sharing ideas, sharing resources, and helping to provide a more holistic support system for the people who need it.
Okay. And I mean, with what you're doing now, like you kind of built your own little consortium, for lack of a better, but with the Outspoken YouTube channel. So that consortium applies and gives a lot of information. The YouTube channel that you've created features various content related to disability advocacy.
Right.
How do you choose what topics you're going to cover? How do you choose who you bring on? And what have you kind of seen as a response from viewers or people that you deal with?
Some of that might come out of a personal connection, a family need, somewhere that I've connected with somebody and I relate to that, whether my son needs a resource or when my parents were living, if they had needed a resource, or people around me that I connect and I think about who could benefit from this. And sometimes it's because there has been a direct connection. Other times it's simply that I learn about something and I think there's more than one person that needs to know about this. So as I'm considering it, it's all about I want to provide a resource and it's to the larger community. So, if all you sell are blue widgets and the only people that need blue widgets are, people that fit a very distinct profile, that may not be the best resource. But if it's a larger population, I definitely have looked at, not everybody has the same diagnosis, but for everybody that has a similar diagnosis, I have featured specific, disability-specific resources, whether that was for Down syndrome or autism or Tourette syndrome or epilepsy, those specific things. Some of them are more broad. Behavior therapy could be people that have multiple diagnoses. And when it comes to the medical community, the legal community, or the financial community, everybody has those needs. So I look at what is really a fit for a larger audience. If it's a one-off, I'm happy to connect you with the resource that you need, but that may not necessarily be something that we have to create a video and do an interview to feature.
Yeah. Looking ahead, Outspoken has had a pretty good run for the first few years of its existence. It's helped a lot of people. It's got a lot of good information out there. What are kind of your personal aspirations for Outspoken, but not just with Outspoken, with your broader, advocacy for the disability community? Like, what do you see, how do you see this growing over the course of the next 5, 10, 15 years?
More resources, more people. So I want to continue to grow. When I started the Connecting Our Community series, I think I had maybe 3 speakers lined up. And I've learned it's kind of, if you build it, they will come. I have yet to go a month without a resource. And I keep building that list of resources because there is such a need. So I do want to continue that. I want to continue connecting to more resources and getting it out to more people. But I want to be able to do more. And some of this stuff, quite honestly, it comes to, is there a cost to it and how do I support that? So I'm really hoping in the near term to partner with a large nonprofit organization so that there's the potential to fund the work that I do for the benefit of the people that they serve. Alternatively to that would be to take Outspoken and turn it into its own nonprofit organization. Because I really, what I see is that there's so much that needs to be done, and it takes time and effort. And let's be honest, I have to pay the bills for my family just like everyone else does. So one way or another, in order to grow, there's got to be a way to fund the growth. But when I look at what other things that will include, I want to have more caregiver or family workshops, going back to every day somebody's getting a diagnosis, and every day there's somebody walking out of a doctor's office that they have that new label and they don't know what to do with it. So there's going to continue to be people that need to be served, and I want to be able to do what I can for those people. Something that I'm also looking into is to provide some kind of event that provides respite for these caregivers. And what I mean by that is I've lived the life and I know that many of these families, they're on a hamster wheel. They get on and they're just striving every day to do enough, to get the right resources, to keep their loved one healthy and happy. They're honestly, most of them aren't even looking into the future because it's just enough to get through today. And for parents that have a child with a disability, when that child goes to bed at night, that might be the opportunity to take a breath. But let's be honest, then they're exhausted and they then fall asleep and wake up the next day and get back on the same hamster wheel. There are resources, and I want to be able to pool those resources because I know how much those families need a break. And I really want to be behind something that can give them the access to maybe just knowing there's other people like me. There's another parent I can talk to. My kid's not the only one that has a certain behavior, but also some downtime, some time for themselves. Those are things that I'm really looking for Outspoken to be able to provide, because all the resources in the world are great. But if I'm a caregiver and I'm overwhelmed and I'm not taking care of me, how can I take care of somebody else if I'm not taking care of me? And I know how that goes. So I want to be behind something that cares for the caregivers as well.
Knowledge is power, but if you don't have the gas tank to make it go, yeah. So I really do appreciate your time today. I know we've got some other things that we've got to do. We've talked through a lot of different topics, but I just want to make sure that everybody knows, if you get a chance, go back and watch some of the old YouTube episodes, because just editing them and going through them and now being part of this, and I appreciate you letting me be a part of this. Who knew, a year and a half ago, us having a conversation would end up here today. But it's very humbling for myself to be a part of this. And there's a lot of things out here that I didn't know. I didn't know were real. I didn't know that this world existed, again, because of the touch points that I never had with it. So I want to encourage anybody else that might be, I'll say from my side of the tracks, to just stick your head in on one of these events. You talked earlier about, not being afraid of it. I know personally it's an awkward interaction if you don't understand things. Having dealt with this for over a year and a half now, like I'm starting to pick up on some of the things that you see instantly, and it's actually changed how I've interacted with people. So, as from one person to another, I would advocate that anybody out there that hasn't had a touch point with this community, do yourself a favor and go out there and get involved in something. You know, it doesn't have to be, you know, to the level that you do, because I mean, you should have a cape, but that's a different story. But, you know, just go out and become a volunteer. Just one event, just see how these things run.
Yeah, I mean, you can come for 2 hours to one event,
Yeah.
and I guarantee you'll walk away with a different perspective.
And at least 5 new friends. I promise that too.
It's also humbling for me to hear that this has made an impact, but that's the point.
Yeah.
And with some of the training, the point is you learn enough that in the back of your mind you can consider things that before that experience you didn't know to consider. If I can make one person think twice about something, I think I've made an impact there. And you know, I encourage anybody, get involved in any way. You don't have to be born into this or have a family member that has a disability to get involved in the community. And everyone is important. Everyone deserves to live a dignified, respectful, and independent life. So anything that anyone else can do to facilitate that is greatly appreciated by all involved. I guarantee you'll enjoy it.
So again, thank you for your time, and I guess we'll see you next month. Thank you.